So today, we're going to dive into a pretty powerful brain imaging technique. It's one that can reveal dangers that are literally hiding in plain sight. It's called FLAIR, and honestly, it's changing the game for how doctors see inside the human brain.
But let's just start with a really important question. Can a standard brain scan, even with all the amazing technology we have today, actually miss something vital? And the tough answer is yes, it can. And that's exactly the problem we're going to unpack.
All right, so first up, let's get into the fundamental challenge here, which is trying to see the unseen inside the brain.
Look, conventional MRI scans are, without a doubt, incredible tools. They usually use what's known as a T1 sequence, and you can think of that as a super high-resolution camera giving us a detailed map of the brain. But, and this is a huge but, they're not perfect. Sometimes, really subtle signs of a disease can just get masked or don't show up clearly at all, hiding literally in plain sight.
So how do we fix this? Well, this is where a really brilliant enhancement comes into the picture, giving us a whole new way to see. Let's break down this FLAIR technique.
Okay, so the full name is Contrast Enhanced FLAIR, but pretty much everyone just calls it CE FLAIR. The best way to think about it is like noise-canceling headphones, but for an MRI. The FLAIR sequence gets rid of the bright signal that comes from the brain's natural fluid, and what you're left with is this beautiful, dark, quiet background. Then when a contrast agent is injected, any active areas of disease just light up with incredible clarity. It turns down the background noise so the really important stuff can just pop.
And this comparison right here really gets to the heart of the difference. In a conventional scan, that bright signal from brain fluid can totally hide subtle lesions if they're nearby. But with CE FLAIR, poof, that fluid signal is gone. The background goes dark, and suddenly those exact same lesions stand out, clear as day.
Okay, so the theory sounds great, right? But what does this actually look like in the real world? Let's dive into our first case file, making brain tumors more visible.
And the results? They're honestly pretty striking. In studies looking at brain tumors, CE FLAIR gave a clearer picture of the tumor in more than half of all cases when compared to the standard scan. Think about that. A greater than 50% improvement. I mean, that's a massive leap forward in diagnostics.
So what does that actually mean for a doctor or a surgeon? Well, with a conventional scan, the edges of a tumor can be kind of fuzzy, a little unclear. But with CE FLAIR, boom, they become sharply defined. And this means targeting the most active part of a tumor for a biopsy goes from being a bit of a guess to being highly accurate.
And this is the part that really matters, right? How does this actually change things for the patient? Well, by seeing the true size of a tumor and pinpointing the absolute best place for a biopsy, FLAIR can give surgeons information that might fundamentally change the entire surgical plan, and that can lead to much better outcomes.
But wait, it doesn't stop with tumors. Let's turn to our next case, multiple sclerosis, or MS, where FLAIR has become, well, a real game changer.
And you know, if you thought that 50% number for tumors was impressive, get ready for this one. It's staggering. For patients with MS, CE FLAIR was found to be better at detecting active disease plaques in nearly 90% of patients studied. That is just an enormous jump in how sensitive these scans can be.
I love this part. The source material uses this really vivid language to describe what doctors are seeing. It says the lesions appear as ultrabrillantes, which means ultra-bright points. Against that dark, quiet background of the FLAIR scan, the active MS lesions just shine, making them basically impossible to miss.
You can imagine, for a chronic condition like MS, having this kind of clarity is absolutely critical for managing it over the long haul. It lets doctors clearly tell the difference between new, active inflammation and old, scar tissue. That helps them figure out if a patient's treatment is actually working and gives them the data they need to effectively plan the next stage of care.
Okay, let's move on to our third and final case file. Hunting down really dangerous brain infections, like meningitis.
Now, infections, they present their own unique challenge. See, when there's inflammation, a lot of different things can light up on a scan after you inject the contrast dye. The trick, the really crucial part, is telling the difference between the actual inflamed tissue, like the lining of the brain, and the normal signal you'd expect from healthy blood vessels. And this right here is where FLAIR is just a superstar. On a standard scan, both blood vessels and inflamed areas can light up. It can be a really confusing picture. But with FLAIR, the signal from the blood vessels gets suppressed. It's only the inflamed areas that shine brightly. It cuts through the noise and provides a clear, unmistakable signal of an infection. And let's not mince words about what's at stake here. When you're dealing with aggressive brain infections, getting a fast, accurate diagnosis isn't just helpful. It can literally be the difference between life and death. This kind of clarity means treatment can start in time to save lives.
So we've seen 3 really powerful examples. But does this mean we just throw out the old technique? Let's put all the pieces together and get a more complete picture.
So, what's the verdict? Well, the expert consensus from all the research is actually crystal clear on this. CE FLAIR is not meant to replace the standard T1 scan, not at all. The T1 is still the gold standard for seeing the brain's anatomy. Instead, CE FLAIR is a powerful partner. It's meant to be used with it.
So the ideal approach becomes a super simple 2-step process. First, you run the standard T1 scan to get that rock-solid anatomical detail. And then you add the CE FLAIR sequence to specifically hunt for those sneaky, subtle lesions in inflamed areas that the T1 might have missed. It's the best of both worlds.
So why go to the trouble of using both? Why is this combo so powerful? Well, because together they cover all your bases. You get this huge boost in sensitivity for hidden lesions. You get much better at telling the difference between a solid tumor and just some swelling around it. And crucially, it can help doctors detect early-stage metastases, the spread of cancer, way sooner. It's all about creating the most complete, most secure diagnosis possible.
And all of this kind of brings us to a bigger final thought. The story of CE FLAIR isn't just about one new MRI sequence. It's really about the power of perspective. It proves that sometimes the biggest breakthroughs don't come from some brand new invention, but from just finding a new way to look at something we thought we already understood. Which really makes you wonder, right? What other medical mysteries are just out there, waiting to be solved if only we can learn how to see them differently?